Hey folks, it's Dr. Sam, and I received a question from a mom who's got a 3-year-old diagnosed with astigmatism. She's also an occupational therapist, and she tried a couple things. She tried patching her son for 6 hours at a time, and that didn't seem to work. And then she ended up going to an eye doctor, and he prescribed some glasses. So with astigmatism in the eye, astigmatism means an eye twist, but it also means a body twist. So any prescription in the eye is also in the body. I know this because after many years of doing craniosacral therapy, patient would come in and I would measure their prescription. I would do an hour of craniosacral on them, and then I would find their prescription would be reduced sometimes up to 50%, and that's what I would prescribe. So definitely stress and tension plays into our prescription. But as a 3-year-old, this is a very formative age, and first of all, patching is very ineffective. It's confusing, it's traumatizing. The child has no idea what you're asking him to learn or to do, and it's basically forcing something. Whenever you force something, it's not going to work. So patching is definitely not effective. Number two, as a 3-year-old, prescribing glasses at that age is actually only going to make the prescription more embedded. And as a 3-year-old, you don't have the same distance visual acuity requirement that, say, a 7 or 8-year-old has. So it's unnecessary to prescribe glasses at that age, and it just makes the situation worse. So the physical therapy exercises where you're treating the whole child is the way to reduce astigmatism and ultimately connect the eye, brain, body in an efficient and healthy way. Now, some of these physical eye therapy exercises include things like primitive reflex integration therapy. A lot of people don't know what this is, but these are very early infant movement patterns that occur after birth, but every child then should integrate them by about age 1. And a lot of kids who don't integrate those primitive reflexes, perhaps because of birth trauma or illness, sickness, they hang around and they actually can influence your eyes getting worse. The second type of therapy included would be gross motor therapy, where you're also bringing in the vestibular system with the visual system, and bilateral integration movement exercises, and then of course adding the fine motor things like visual tracking and visual focusing and so on. So there's a developmental arc of introducing physical vision therapy to kids, which is super effective, and it's been the cornerstone of my practice for almost 30 years. So I hope this is helpful to you and to everybody who's got kids. I want to thank you for tuning in, and until next time, take care. If you like this video, hit the subscribe button and turn on your notifications. Please send your comments to me. I'd love to hear from you.